Okay, good morning, everyone, and thank you so much for joining us. Welcome to the UCLA Peers Information Session. So PEERS stands for the Program for the Education and Enrichment of Relational Skills. Okay, so just to let you guys know, we're actually going to be recording this presentation today, and that's for informational purposes in order for us to distribute to anyone who's actually unable to attend. Okay, so let's get started. So we are excited to share that the PEERS program is actually going to be delivered here at the Wellness Center. We are a licensed health facility, and we were actually established in 2004, and we recently moved to a new location at Smith Road Center, where it is really the second home to about 26 of us. So we have a ABA team, we also have a clinical team, and we have an administration team. So the administration team, they're really the heart of the operations, running to the day-to-day. We also, the clinical team, so we are in charge of the psychological aspect, mental health services as well. And the ABA team, they primarily do ABA therapy, which is applied behavioral analysis, which is a type of therapy that focuses on improving social behavior. Okay, so about us. So we are actually, my name is Khadija Chisholm, and I am an associate psychologist from the clinical team. Now, I'm actually responsible for things like the psychological assessments, so conducting them under the supervision of the clinical manager as well as my director, and I provide psychoeducation as well, and also social skills training to individuals and group sessions as well. And my colleague, Jessica Derrick, who will actually be speaking to you later in the presentation, she's a senior behavior technician from the ABA team, and she's actually on track to becoming a board certified behavioral analyst. So that's a little bit about us. Okay, so our agenda. So today we're actually going to talk to you about what are social skills, what are the importance of social skills, what is PEERS exactly, what is the evidence for PEERS, and who is it for? And finally, how is it delivered? Okay, so social skills. What are social skills? So social skills are the ways in which we interact with each other, but it's also focused on how. It's really the quality of those interactions. So for example, how are we showing eye contact? How are we showing that we're listening as well? What's the quality of that like? So for example, with listening, often we are talking to somebody and maybe they're not paying attention, maybe they're doing something else, and we'll say to them, hey, we'll ask them a question and we'll say, hey, are you listening? But how do we show that we're listening? And this is what we try to teach children as well. How do we show that? What's our body language like? Are we giving that person eye contact? And then in terms of feedback, how are we providing feedback as well? Are we able to repeat back to that individual what it is that we heard? So all of these are social skills that we are using on a day-to-day basis. So even things like being patient, having good manners, and being a friend. So being able to connect with others, being able to empathize. Again, these are all social skills. So why are social skills important? So social skills are really important for effective communication, and it's how we relate to others, and most importantly, how we connect to each other. So we're talking about our feelings, our experiences, sharing ideas, our thoughts, and connecting with others allows us to grow our social networks. And then of course, having a good social network, that's having a good support system as well. So again, when we have a good support system, in life, like it actually increases our happiness because we're able to relate to others. And if we're having a hard time with something, we're able to go and say, hey, I'm struggling in this area. And that person can be there for us. So again, it increases our quality of life. And then even things like career prospects. So you could be like an HR manager and you'll have two excellent candidates for a position. But again, what it might come down to is the social skills. How would that person relate to the others? Right? Will they be a good fit for our team? How will they interact with clients? How will they interact with customers? So having good social skills will actually put you in higher stead as well. And social skills on a whole are actually a predictor for success, because what we want is we want kids to be as independent as possible. And what it really comes down to is you could have a child who is excelling academically, they're doing really well academically, and you could have a child who might be struggling. And I think it's very important that when you have good social skills, that your child's able to communicate their needs, they're able to advocate for what it is that they want. So again, having good social skills will allow that. Okay, so what is peers? So peers is actually an evidence-based social skills training intervention for children, adolescents, and young adults as well. And peers was actually created based on socially successful children. So that's what they went out and they asked them, socially successful kids, what works? And when I say socially successful, I mean kids that are well-liked, kids that are able to maintain friendships. So they asked them, well, what works? And that's what actually ecologically valid means. Ecologically valid means that you can apply something in real life and again, it works. So often we'll say to kids, you might have a child who's super anxious, right? And they're at a party, for example, and you'll say to your child, hey, just go over there and say hi. Just please go over there and say hi, right? But we have to understand that we're not setting them up for success because so much happens in between that. So much happens before we go up and say hi, right? So we have to look out for body language. Are those individuals turning towards us? What about eye contact? Are they looking in our direction? Are they looking at us? So you have to be invited into a conversation, right? And it's only at that point, after all of these social cues happen, that you can actually say hi and it be effective. So imagine having a socially anxious child and then telling them to say hi, but then they could be interrupting somebody, you know, it could just not be the right time. What happens is if they're rejected in that moment, then you're going to have an even more anxious child, right? So that's not a practical solution. So again, what we want to do is we want to give something that really, really works. So another example, and I want to make this bit actually kind of interactive. So please just drop your response in the chat box. So when we have a child who is being bullied or our child is being bullied, what do we often say to them? What do we typically say to children who are being picked on? How do we tell them to handle it? So if you have a response, just put it in the little chat box, what you think that we typically say to kids. Okay, no responses yet, but that's okay. It's super early in the morning, so I'll tell you. So typically what we do is we'll actually say, oh, let's see, someone responded. Just ignore the other child. Excellent. Yes, thank you. That's right. So we typically say, just ignore that behavior, ignore the other child. Or we'll say, tell an adult. These are the two things that we commonly say, tell an adult or ignore the child. Now, let's think about that. So if we try to get into the psyche of a bully, right? Bullies, they want attention. They're attention seekers. So if we say to the children, if we say, okay, just ignore that behavior, what's going to happen with the bully? What's going to happen with the bullying? The behavior is going to increase, right? Because they're not getting a rise. So they're going to continue to do that behavior because, again, they want a reaction from you. So that doesn't work. So we can put that theory on the side. Now, the other theory, which is to tell an adult. So again, telling an adult, it does seem like it's the right thing to do. But again, what we're saying is, actually, when we tell an adult, let's think about that. So now your child has told an adult, and now the other kids might have found out that they've told on them, as well as the bully themselves would have found out that they told. So now there's that social implication that, oh my goodness, your child is now a tattletale, or your child is now a bully. Right? Sorry, your child's a tattletale, or your child is now also a snitch, right? So again, that has ramifications for that behavior. So we're not saying that it's not good to tell an adult in certain circumstances. Absolutely, it is. But the peers program is very specific, especially when it comes to that verbal bullying. There is what we want to say is that there's a trick that can be more effective when it comes to handling that type of bullying. And what it is, instead of keeping you in suspense, is it's actually called a quick comeback. So instead of saying, so what happens when the bully approaches the child, then they'll say, yeah, and That's the response. So the research suggests that just a quick comeback, such as yeah, and obviously looking not bothered, is actually a much better way of handling that. So again, that's what we want to teach children, right? That works. That is ecologically valid. So again, that's really what makes peers so successful, is that it'll work in real life. And that's what we want to do for our children, give them practical solutions for what we consider real life problems. Okay, so there's 3 different components to peers. There's the parent session, child session, and there's homework as well. So with parents, it is absolutely, your involvement is key. And again, that's what research suggests as well. Research suggests that parents being involved yield much greater results. So absolutely, what we want to do is in the sessions, we want to train you parents as social coaches, because again, this is what you're going to be taking all the way throughout the program, right? And even beyond that. So you're going to be responsible for generalizing the skills that are learned. So in the parent sessions, we focus primarily on what the skill is and how you practice that skill with your child, how to help generalize that skill. Because again, like I said, Peers is a 14-week program. But again, you are your child's biggest cheerleader. So you're going to be with your child, and you have to have those opportunities to make sure that you are constantly reinforcing that behavior. And that could be up until high school. That could even be up until university. But the real point of having a program like this is, again, making children as independently as possible. And in order to do that, we've got to make sure that the skills are generalized, which is why parent involvement is key. So with the child session specifically, what we're doing is we are teaching, again, the skills. So it's like a lesson. We are teaching them that skill specifically, and then we'll do a lot of role playing around that skill. And then for the homework aspect, that's really practice. So you are practicing that skill over and over in the community, at school, at home, constantly, right? And then you as a parent, as their social coaches, you are ensuring that, they're getting the steps right. And then if they do get them right, you're giving them praise as well. And if they don't get them right, then you're giving them feedback. So all those components together is what makes peers very successful as well. Okay, so just a little bit of background. So Peers was actually developed in 2005 at the University of California in Los Angeles by Dr. Elizabeth Logson and Dr. Frank Frankel, who are clinical psychologists. And they work primarily with children who are on the spectrum, who have autism spectrum disorder, as well as ADHD, as well as kids who might have anxiety, depression, and then just kids in general who are struggling socially. So again, the basis of their research, they were like, well, we really want to help these kids, these kids who might be socially rejected or socially neglected. We really want to help them out. So that's why they said, well, why don't we ask the kids that are successful at this? Why don't we ask the kids that seem to have it, right? So again, that's really the basis of the program, what actually works for kids who are successful. And I'm actually really excited to share that Dr. Elizabeth, she actually trained my colleague Jessica and I in the Peers program. And I have to say, she was so excited and she was so passionate about it. And Peers itself, what's really great is it's cross-culturally adapted. So it's actually in 80 different countries, which is so impressive. And it's actually translated in 12 different languages. So you can imagine how excited Jess and I are to actually be bringing it here to the Cayman Islands, knowing how effective it can be. So like I said, so my colleague Jess and I, we were actually trained specifically on the Peers for Adolescents. So there are different versions of Peers. So we've got the Peers for Adolescents. We've also got Peers for young adults as well. And there's actually a school-based version. So I know that there's lots of SENCOs who've chimed in. So thank you so much for joining us. You guys are pinnacle to everything as well. So there is a school-based version for Peers, and it's centered on lesson plans, and that can be done once or twice a week. So yes, we're very excited to share that too. I think what's also very important is, and again, another reason why we were quite excited, is that they're actually working on 2 new versions of Peers. They're doing one for preschoolers that they're trying to focus on, and they're also doing one for individuals with intellectual disabilities. So we will be sure to keep you posted once we get further information about this. So yes, that's enough from me. I'm actually going to pass it on to my colleague Jessica Derrick, who will be sharing with you just about the evidence and the research around peers. Okay, over to you, Jess.
Thanks, Khadija. Good morning, everybody. So I just quickly want to, because we've been talking about how peers is an evidence-based intervention, just go over two studies that really show the short-term effectiveness and the long-term effectiveness of this with you. So to show you where the proof is. So first of all, Laugenson herself in 2019 with colleagues looked at measuring outcomes from the peers intervention. So they did this by taking measures before the session, or before individuals entered in peers, and then again at the very end of peers. So they took measures for the social responsiveness scale, and parents answered this as well as teachers. And then for the teens themselves, they used self-report measures for the quality of socialization questionnaire, the test of adolescent social skills knowledge, the friendship quality scale, and the Pierre Harris self-concept scale. So it was very in-depth study, but I just quickly chose a few graphs to share with you to show some of the areas where it really shows how effective this was. So on this first graph here, we're able to see the mean change in score. So the change in score from the before and the after test. And we can see that this treatment group in the light purple shows a significant increase in the change in score versus the waitlist group. Similarly with the teen social skills knowledge, there was a significant increase for the treatment group versus the waitlist group. And then lastly, for the hosted get-togethers, again, with the light purple, we can see that the teens that participated in peers were hosting many more get-togethers after versus the teens that were in the waitlist group. So that shows great short-term effects. However, we also want to show you the long-term effects, because it's great to have effects right after, but do those sustain over time? And so Mandelberg and colleagues looked at this by taking a pretest before peers was entered, and then they tested again at the end of peers, and then they did a 1 to 5 year follow-up with the participants. So quickly, just looking at the graphs from this, we can see that this blue is the pre-test, the red is the right after peers was completed test, and then the green test was the follow-up test. And in all these areas of the social responsiveness scale, so for social awareness, social cognition, social communication, social motivation, and autistic mannerisms, we can see the T-scores in this all reducing into this normal range, or getting closer to the normal range, which is exactly what we want to see happen. So these are great results. And then quickly, one last graph, just to show the social skills knowledge. Again, T1 is the pre-test, T2 is the post-test, and T3 is the follow-up study. And we can see that right after peers was completed, there was a significant jump up. And although it did reduce a little bit over time, there were still a significant number of skills that did maintain. And so that's great to see. This is what we want to see. So even after peers has been completed, they're still remembering these skills, and you can't implement skills you don't remember. So the fact that they're remembering is great. So after seeing all this, we can talk about who can benefit from peers. So peers is really great for anybody with social challenges. Again, there's a wide range of curriculums that Khadija already spoke to you about. So the children, teens, young adults, the up and coming preschool group, it's really great. So it really can help anybody though, showing social challenges. And although it can help everyone, there has been specific studies looking at the improvement on social skills with individuals with a range of diagnoses. So currently, they have done very in-depth research looking to see the effectiveness of this program on individuals with autism spectrum disorder, with attention deficit hyperactivity disorder, and with anxiety and depression. So these are all areas that have shown great success by utilizing the peers program. So now that we've talked about who it can benefit, let's talk a little bit more about the curriculum itself and what it covers. So we start by laying those foundation skills, really using the learning the skills that we need to start friendships. So trading information, learning how to improve our conversation skills, learning how to read the room, being able to enter and exit those conversations appropriately. And then during the stage, we also help both the teen or young adult and the family help find meaningful friendship groups if those aren't already established. So once we're able to find those friendship groups, we can move into the keeping friends stage and learning those skills that will help us maintain meaningful friendships over time. So the use of electronic communication, the use of humor, and handling disagreements and that will happen in friendships. And then also something that many of our participants don't necessarily haven't had the opportunity to do, but learning how to throw get-togethers and how to have people in your home. So by doing this, we can help sustain or help create meaningful friendships that will sustain. And then after this, we kind of move into other topics. So the adolescent spends a lot of time learning how to handle bullying and how to change reputation, whereas the young adult group, it covers this, but it also has a large section on dating and how to develop those type of safe relationships for individuals at the age of dating. So that's very exciting because not all social skills groups cover that, but we're very excited to be able to give our participants the skills to keep them safe and learning how to navigate those areas. So we've talked a lot about peers, and I just want to summarize some of the reasons that it is so successful. I know these have already been gone over, but they're just pillars to the success of peers. So the fact that it is an evidence-based social skills program, and there has been loads of research that shows how successful it is great. It's something we really believe is important. Also having the opportunity to be able to train a social coach and having parents or caregivers step up into that role, because at the end of the day, that's who's going to be with them after the program is over. We won't always be there, but it's great to have somebody who will be there to help our individuals navigate these social scenarios as they occur in real life. It teaches ecologically valid skills, which Khadija already mentioned, but we just think it's so important to teach skills in the way that their peers are currently using them. So it won't set them apart, but they'll be able to just blend in and use these skills how anyone else would. Also, the fact that it's cross-culturally adapted is key to us to being confident to be able to bring it to Cayman and let it be as effective for us as it has been everywhere else. The use of role-playing and modeling really allows the opportunity for our participants to get the opportunity to practice these skills in a safe environment with us before we send them out and we have them using them in the world. So between that and having the homework assignments, we really feel like we set up our individuals for success. So something that Dr. Logginson spoke a lot about in her training was this equation to progression towards friendships. So she says that to have progression towards friendships, you need skills, you need access to peers, and you need coaching. So we're able to provide the skills in our sessions, and then we're able to help support families in finding the access to peers. And then by providing training to create social coaches for our adolescents and our teens, we're able to help create the progression towards lasting friendships, which is what we all want for our kids. So now that we've spoken a lot about peers itself, we can talk about how we can access it through the wellness centers. So right now, we will be offering a variety of different delivery methods, starting with the more traditional groups, which will be around 8 to 10 participants in a group, and we will be dividing them into age groups. So starting with early adolescence, which is 9 to 12 years old, kind of the late primary school age, and then moving into an adolescent group, which would be 13 to 16, so the high school age, and then the young adult group will be after high school graduation, so 17 and up. And this will allow us to be able to tailor the program towards the needs that are in those specific groups. So we're very excited about having the opportunity to offer to be able to target those age groups. So there's also one-to-one direct delivery options. So if a teen is interested at joining when a group isn't necessarily about to begin, or if maybe they don't exactly fit with the group or they need a little bit more support, one-to-one direct delivery is a great option as well. And that still involves work with one-to-one with the team, but also with the parent as well. So they're still getting all the benefits that you would out of a group. We will also be looking to host boot camps. So this is where we would choose a topic and just focus on it for 1 or 2 days to give the community the skills from those topics. So bully proofing, friendships, conflict resolution. So those kind of key areas, just in a shorter time frame. And then you can also find the concepts taught by peers embedded into different curriculums that we currently offer. So Passport to Success is currently run by the Wellness Center. So we'll be able to put a lot of our concepts into that curriculum. And then also in our current ABA services, we can pull up chapters and help support our clients as needed. And we're also looking at flexible telehealth options, something that everyone, I'm sure, is getting used to at this point. We're hoping that that will help us be able to support our families best. So thank you everybody for listening to our presentation today. We really appreciate getting the chance to share this. We really believe in this curriculum and are excited that KMAG can start to benefit from it.